Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Monday Health Minutes. National Diabetes Month. It is the month of November, so we're here to talk about that today. 1 in 5 Americans don't even know they have diabetes. So what are the signs? What do you do? What help is there out there? We're talking with Dr. Michael Amos about that today. Thanks so much for being here.
Thanks for having me, Melanie.
It's so surprising that the numbers are so prevalent and people don't even know. So what are the signs that people can look for that they may be diabetic?
So sometimes it's actually a little bit sneaky. Things that we see with our athletes out playing and they're drinking a lot and having to use the bathroom more. Things like maybe not healing as well on your feet or on your hands. Some of these things can be subtle signs that we might be looking at something deeper and we need to take a look at a doctor's office to see if maybe you are diabetic.
So talk to me about that process. How are you diagnosed? What is the diagnosis process like?
It's really easy, actually. Sometimes it can just be with the prick of the finger, and we get a glucose in office, which is your blood sugar. And so we look at that number, and depending on where we are in the day, if you've eaten or if it's first thing in the morning, we can take a look at that and say whether or not you are diabetic. And so it's very interesting to see how people develop diabetes, sometimes with or without them knowing it, and we are able to catch it. In addition to your coming in if you feel symptoms, there are also screening recommendations. Most people in West Virginia actually are recommended to be screened for diabetes within the every 1 to 3 year time frame. Sometimes we keep up with our health in routine screenings and we find it on those tests.
And then it's so important to diagnose it early because diabetes can have a host of complications that can't be reversed.
Right. It is very important to keep control of your diabetes, and the faster you find it, the better outcomes can be over the lifetime. It is a marathon, not a sprint. We talk about with patients, it might not hurt you to have a high blood sugar today, but running high and having high blood sugars throughout 10, 20 years, you will have issues with vision, kidneys, your arteries can become having increased plaque and buildup that can lead to heart attack and stroke. So it really is such a pervasive disease in that it can affect so many parts of your body.
Yeah, we have to keep watch for sure. So if you discover I am diabetic, what are some of the treatment options that are available?
Yes, so I break the treatments down into 3 big classes. So there's pills that you can take every day. There are shots that you can take like insulin, and then there are non-insulin injections, and those are actually the newest on the market, and they show huge promise for people with diabetes to be able to reduce their risk of cardiovascular disease as well as keep control of the diabetes that they have. It's very promising because some of them even are just 1 shot per week. That's where I convince a lot of my patients to actually be, is I give you 1 shot a week, you don't have to take any pills, and your diabetes is managed, and so they're very appreciative of that.
If you're beyond that 1 shot a week, there are lots of different options that you consider because I know insurance coverages can be kind of all over the map.
They are. It is very difficult sometimes to get certain drugs approved, and so when we look at things, we look at the insurance coverage and what the pharmacy tells us is going to be covered, and so trying to work in what's best for each patient. So outside of those shots, there are probably at least 5 to 10 different pills that you can take, and then there are, of course, insulin. And I always tell my patients, if I can't get you controlled with the shots or with a pill, then I can definitely get you controlled with insulin.
If you think you have a problem, should your first call be to your general practice, your family physician?
Yes. So we at Valley Health are prepared to screen whoever thinks that they might have symptoms. We can screen for diabetes at all of our offices with the random sugar checks, or we can also do a blood draw. So we're there to help.
Yeah, it's important for us all to be aware of, for sure. Dr. Amos, thank you so much.
Thank you.
Thanks for being here for Healthy Monday. We'll see you next week.